This series will explore the intersection of health and technology, diving into the tools, challenges, and breakthroughs that are shaping how we care for ourselves and our communities. My name is Nerese Millette Williams, and I'm the project coordinator for the UME Marylanders online program. And this event is brought to you by the University of Maryland Extension, Marylanders Online, in partnership with the College of Information and in collaboration with our Family and Consumer Sciences Department. We have a great session planned for you today, so we're so glad that you're here to be a part of it. Before we get started, just want to make sure you all can see my screen. Yes, you can. Okay, so I want to state that all university programs, activities, and facilities are available to all without regard to race, color, sex, gender identity or expression, sexual orientation, marital status, age, national origin, political affiliation, physical or mental disability, religion, protected veteran status, genetic information, personal appearance, or any other legally protected class. Additionally, please see the following slide that includes QR codes for meeting our speaker for today, completing the conference survey for this session, and then registering for the last two webinar series that we have. Let's hold this up for a second. Additionally, you can find these codes on our website or the program agenda that was sent to you. So I'm thrilled to kick off today's session. And today we're going to be joined by Dr. Tatiana Warren discussing policy, health misinformation, and public trust. Dr. Tatiana Warren is a social behavioral scientist and public health leader specializing in health equity. With nearly 20 years of experience across healthcare, academia, and community service, she focuses on advancing research and partnerships to eliminate health disparities. She co-directs the Community Engagement and Dissemination Core at the Johns Hopkins Center for Health Disparities Solution and serves on the advisory board at Syracuse University Folk College, offering industry insight and supporting student development in public health and sports science. And she is also the CEO of her business, Just Tati. So please, it's an honor to have you here with us today, Dr. Tatiana, and everyone, please welcome her.
Thank you so much, Nerese. I really appreciate that introduction and warm welcome. I'm excited to be here on this Friday after Juneteenth and really have a conversation around safeguarding public health in this digital age. This is an important topic and near and dear to my heart. Over the last 5 years, I've spent a lot of time in this space to make sure that lay members, community members, and leaders, as well as our university communities and federal agencies, are working together to make sure that health equity and the right information is at the table. And so I really want to take the time to explore how misinformation, especially during public health crises, intersects with equity and what we can do and how we can do that both with clarity and compassion. Um, One thing that you did say about me during the introduction that I want to point out and highlight is who am I? Locally, what I do love, especially, is that I have the opportunity to serve and have done so for the last, this September will be 8 years, served as a co director for the Community Engagement and Dissemination Core at Johns Hopkins University. And at that core, we have been able to partner both with our faculty members and staff and the local community in Baltimore to ensure that we are working collaboratively to address both health disparities and health equity in the community. So I'm passionate about doing this work. I've been in this space for coming up on 2 decades, and really focus on how can we end needless suffering to underserved and under-resourced communities. Um, I do want to share a little bit, take a little time to just sort of highlight some of the work that we do at the Hopkins Center for Health Disparity Solution. Our mission is really focused on place based strategies, and we really try to ground ourselves in not only generating but also disseminating knowledge to reduce the racial, ethnic, and social class disparities that we see. Um, I do want to say that we do this in collaboration again with many institutions nationwide, but also with an amazing community advisory board, and myself, along with some other key leaders, serve as the directors, you know, and help to partner with the community advisory board. So Colonel Jimmy Slade, Michelle Spencer, and Professor Janice Bowie. We are the co-directors over the Community Engagement and Dissemination Core, which helps to facilitate the work through the Community Advisory Board. Much of the work that I will have the opportunity to do today, and these are our objectives. Um, so I want to take time to ground us in these objectives. One, we want to understand how misinformation really impacts health equity, how we can explore actionable steps and communication strategies towards mitigating some of the challenges that come out of that. Learn how to build digital resilience, and also identify possibly the role of policy and how trusted messengers, community based organizations, community health workers can help advocate in this space. And I'll do that, of course, through research that I've been involved in, but also real life experiences. Right? I'm going to take time, of course, to thank partners. I will share again some research projects that I've actively participated in, or my team has actively participated in, and then I'll also want to take an opportunity to just again share how this work sort of helps to move the agenda forward in the health equity space. So thank you to Kaiser Permanente, the FDA, of course, John Hopkins, CDC, Go Vax Initiative, Good Health, Great Here, another initiative in the Office of Minority Health and Health Equity. Thank you to all of our partners. So, really, why does this topic matter now? Misinformation in recent public health crisis. If we think about COVID-19, many of us, all of us throughout the world was impacted. And at any given day, we did not know what information to believe. We did not know whether to get vaccinated or not vaccinated, to trust the government or not trust the government, to trust what we see on social media, whether it's Facebook or Instagram or YouTube or TikTok now. And really, it was things were happening so quickly in terms of folks really learning about what is a pandemic, really learning about COVID-19, and then also learning on how they can empower themselves to make decisions towards their health behaviors and their health habits. So today, although I'm grounding this conversation and say these are the reasons why this information is important and near and dear, it's also important to know that it can be harmful during health emergencies, when trust and clarity is being challenged, and when misinformation is at the table. Again, I shared that I work closely with Kaiser Permanente during the pandemic. They were awarded a $500,000 over 9 months through the Maryland Department of Health to do a GoVax vaccine equity a vaccine equity initiative, rather, excuse me. And one thing that we really realized with this particular initiative is that it helped to reach underserved and under-resourced communities and persons who were not maybe well informed about COVID-19, who were not well informed about, so do I social distance or do I not? How do I wash my hands properly? Hygiene, wearing a face mask, all the information that was coming out. And that initiative was so successful because Kaiser Permanente had already had an imprint prior to the pandemic within hard to reach communities through their Good Health, Great Here initiative, which was a barbershop mobile health van initiative dispatched to do pop-up wellness clinical screenings in communities. Um, when we partnered during the pandemic and at the height of the pandemic, a lot of folks could not, and a lot of healthcare systems could not get to zip codes within the greater Baltimore, DC, suburban Maryland areas, and even in Northern Virginia areas where folks were underinsured or uninsured, or even undocumented. And Kaiser Permanente and their trusted messengers really served as a trusted partner in that space. So I'll talk a bit about that information in that project, but I want to go to this video that talks about health misinformation and infodemic. That might be a new word for some of us.
Welcome to Universal Digital Health. Today we tackle an important issue that affects everyone: health misinformation and the growing infodemic. In an age where information spreads faster than ever, how do we separate fact from fiction? An infodemic refers to the rapid spread of both accurate and false information, often overwhelming people and making it difficult to distinguish between facts and myths. During health crises like pandemics, this can have dangerous consequences. From viral posts on social media to misleading articles, misinformation can spread faster than the actual disease. Misinformation can lead to panic, poor health decisions, and even life-threatening consequences. Whether it's promoting fake cures, encouraging dangerous health practices, or spreading fear, the effects can be devastating. From vaccine hesitancy to harmful miracle cures, health misinformation has real-world impacts that put lives at risk. So, how can you protect yourself? First, always check the source. Is it a credible health authority, like the World Health Organization or CDC? Second, be cautious of sensational headlines or posts that evoke strong emotional reactions. Fact-checking platforms like Snopes or factcheck.org can also help verify the accuracy of the information. Thankfully, digital health tools are helping in the fight against misinformation. From AI-powered fact-checkers to apps that provide reliable health updates, these tools can help filter out the noise. By using these tools, you can stay informed with accurate, evidence-based health information. Finally, it's important to rely on trusted health sources. Always cross-check health claims with established organizations like the WHO, CDC, or your local healthcare provider. By trusting experts and not rumors, you can make better decisions for your health and the health of those around you. The infodemic is a challenge we all face, but with the right tools and awareness, we can overcome it. Stay informed, stay safe, and always question the information you come across. Thank you for watching. Don't forget to like, subscribe, and hit the notification bell to stay updated on the latest in digital health.
So that music was extremely daunting. Um, and I hope that for those who are viewing today, that we consider how the intersection of misinformation and health equity can really have a harmful effect on our communities. With information again spreading faster than ever, it's really crucial to understand who are those credible and reliable sources. Of course, as mentioned, the World Health Organization, the CDC. We really want to, the FDA, NIH, National Institutes of Health, and we can share these resources as well. We really want to rely and verify these facts, right? Because misinformation can be dangerous, but with right awareness, we can combat it together. Um, so understanding the social determinants of health, understanding who's really most impacted, which primarily are marginalized communities. They're more often affected due to the limited access to reliable info and historical trauma and systemic barriers. And we'll unpack those root causes. But I want to share, for 2 years, I participated with a federal campaign. And my primary role as a social scientist with that project was to conduct focus groups nationwide about the risk of skin bleaching and skin lightening creams. And one thing that we learned that was extremely shocking across all racial and ethnic groups, socioeconomic status, even geographical locations, was that folks are not using trusted sources to gather their health information. Primarily those who are under 25 or even under 30, or young millennials, Gen Zs, tend to go to TikTok for to gather and get their health information. Older millennials, baby boomers, Gen Xers, they tend to use YouTube University. And I also learned even through that process that, you know, that verifiable blue check, if you have that near your name on your social media platforms, then that validates you as a credible source. But it, in fact, does not. And so I want to encourage those who may work with community members and lay members. Is not just important, or it's not just enough to, share the information and give out the health information resources, but it's important for us as public health practitioners to also teach persons on how they can access this information, make it readily accessible, but also ensure that they are empowered and know how to get this information. So I kind of got ahead of myself. I was sharing these real world examples. Again, as I shared during the COVID-19 vaccine, there was so much misinformation. And I'm sure that each of us probably have, personal stories. Many of us lost loved ones as well because of misinformation and not really having an understanding or full grasp on things that were happening. The impact, again, disproportionately affected Black and Brown communities, right? So if we think about the GoVax campaign, if we think about the federal initiative that I just talked about in terms of skin bleaching and creams, and how the mercury and the hydroquinone can impact and how you can have associated health risk, all of those things lead to disparities in health outcomes that we see within most of our marginalized communities. So if we consider sort of the role of crisis communication, this conversation that Marylanders Online is having in this webinar series, I think is so special because it's not only timely and clear, but also it's important to be culturally competent. We need to have culturally competent messaging, right? Especially during crises, and we have to be fast. And I do want us to take an opportunity to think about the key components for effective messaging, right? And what those common challenges are in public health communication. We're going to share another video, and I hope that on this Friday we get a little chuckle. But I want you to consider, maybe even in the chat, and I know a few folks are monitoring the chat, what works in a crisis? Like, what are 3 to 4 key principles that you think could really help doing crisis communication? What could have improved our communication strategy as a nation during COVID-19 or during any other pandemic or epidemic that we have experienced thus far? I want you to think about that as we go to this next video.
We'll be asking the questions, old man. Who are you?
You.
No, not me, you.
Yes, I am you.
Just answer the damn questions. Who are you?
I have told you.
Are you deaf?
No, you is blind.
I'm not blind, you blind.
That is what I just said.
You just said what?
I did not say what. I said you.
That's what I'm asking you.
And you is answering.
Shut up. You.
Yes?
Not you, him. What's your name?
Me.
Yes, you.
I am me. He's me. And I'm you.
So, many of us probably watched Rush Hour 2 with Chris Tucker, and remember this particular clip. But what I want us to sort of take away from the video is that miscommunication isn't harmless. It creates misinformation, which is harmful, right? So, during a crisis communication, again, we have to be fast. It has to be credible, but it also has to be culturally responsive. And we have to make sure that saying something louder and repeating it again does not ensure that you are effectively communicating that message to the intended audience, as we saw in the video just now. So, anyway, what are I think some folks are writing in the chat. We see collaboration, community, trust in terms of 3 to 4 key principles that can work in crisis situations. Most certainly, being calm. I love that. Being non-judgmental and consistent messages. Are there any others that we can think about in terms of what works in a crisis? 3 to 4 key principles that may work. Listening, clear, concise communications or instructions, calm tone. Yeah, we saw Chris Tucker just kept screaming, right? And he was just missing sort of those cultural cues in terms of names. Also, consistent messaging from local, county, state, and federal levels most certainly is definitely important. And doing so in a collaborative way, right? Where your local community or your local CBOs are not sharing information that's not in alignment with the state or even with the federal information and data that's coming out. And then language interpretation and translation. I love that one. That is a special one, most certainly for me. I'm a first generation American with roots from Panama, Central America. So growing up in a multilingual household and still having one today, that oftentimes there's so much that can be misinterpreted and lost. So we'll go to the next slide. So I think everything that many of you wrote in the chat and shared with us, but I do want to leave you sort of, when thinking about crisis communications, or if you're experiencing a crisis at any level, really, not only just in health equity or in the public health space, and obviously that's today's conversation, but even in our personal lives. I think if we begin to practice these things on a regular or recurring basis, when a crisis comes up, it's easier for us to respond. As I shared during that GoVax initiative, in partnership with Maryland Department of Health and Kaiser Permanente and the barbershop and salon partners, it works so well because in the greater Baltimore area prior to the pandemic, the culture was such that when you went in to get your haircut, or you went into your hairstylist, that person has a level of intimacy. There's a level of transparency and vulnerability with someone who is grooming or providing grooming services to you, and those relationships are formed over time. And so our barbers and our salonists tend to know information about our personal lives. They tend to have an understanding about our struggles. They can even be our therapists at times, right? And we leverage those trusted messengers through that initiative to really not sort of point the finger and say, hey, you have to be vaccinated, and take away that autonomy from the individual, but rather make sure that they knew where to access health information. They knew how to access the reliable information and resources. sharing that through our barbershops, sharing that through our salon partners, sharing it also through even our community-based organizations, so that when Kaiser Permanente was on site and on staff, they could come and be present to give out those vaccines, and make sure that people were staying safe and staying boosted. But again, the initiative was so effective in Maryland because of those already established relationships. So again, making sure that you think strategically during crisis communications, stick to the facts, don't wait too long, have tools ready. We'll share some of those tools later. Use social media wisely. That's such an important one. And I know that through these webinar series, we have 2 more sessions, and you'll get some additional tips surrounding that. You want to keep stakeholders and all stakeholders really well informed. And then you want to support your spokespeople as well, right? Your spokespersons. So trusted messengers matter. And if I have not said that before, I want to say it loudly right now, right? That the message matters, yes, but the messenger may matter more. Okay. People trust those they already have an established relationship with. So if it's your faith-based partner, if it's a community organization, if it's our school-based partners where your children go to school at, if they're local clinicians, local leaders, again, I talked about the barbers and your salon partners, your nail technician. These tend to be persons in the communities who we trust. And so making sure that we're partnering with them so that they can help to disseminate information is also important, but that they disseminate the right information. If we think about also during, I want to go back to the pandemic, the COVID-19 pandemic, Juvenile was a part of the Vax It Up initiative, right? He's a local rapper. His messaging is tailored to a specific population, often hard to reach when making decisions and informed decisions around health. And because of his partnership, again, many youth and young adults were vaccinated during COVID-19. So we need to be able and ensure that we meet people where they're at. Community health workers tend to be a good foundation in terms of reaching communities and reaching marginalized communities at that, because community health workers tend to have the same lived experience. They tend to speak sound and come from the same communities, and they're passionate about doing the work. So they're passionate about making sure that you are well informed. They're passionate about advocating for appropriate policies. They're passionate about staying informed and also sharing that messaging across even maybe their personal and or professional platforms. So trusted messengers do matter. And all of this really aids when building digital resilience, right? We want to, it's not just enough to really fight for misinformation. We must also equip communities with tools, with the ability to ask the right questions, or ask any question really, and feel comfortable doing so, right? That they can also verify and engage with the information critically, right? Digital resilience is important. And understanding when you might be at risk online is also important. Knowing what to do if something goes wrong, learning from those experiences, understanding who to report them to, and being able to recover from any difficulties or upsets. Having strategies to really teach the media literacy is also extremely important all the time as well, right? We want to just, be imperative as well that our children and our young adults, that they learn to be digitally resilient from a very young age, right? So how do we do this? We prepare by having good sources of information. Again, federal sources we really want to go to, government resources. I know that this can be a difficult time that we're in. And in fact, just a few months ago, many of our government agencies had taken down a lot of these health resources and health information. But since those executive orders and changes, much of that information has returned to our websites. So again, directing folks to the World Health Organization or agencies like the CDC and the FDA and NIH, right? Having an understanding of those stats and how to, how to really empower communities to just vet and verify the information that they are really accessing today. And then, of course, equitable policy solutions, right? So all of this is important, but it's only important as much as we have frameworks that really support information that has equity, okay? So whether it's accessibility and language, digital inclusion, which I don't want to sort of, reiterate some of the things and the topics that we've discussed over the past few weeks and that we will continue to discuss. But what institutions can do right now at all levels is really important. Obviously, Marylanders Online is doing a really good job at hosting this safe space, so we can have conversation from equitable persons, and persons who are really well informed and working in this space. But also our academic institutions have, a stake in making sure that what's published on their platforms is verifiable and also appropriate, right? That we're meeting people where they're at and they also have an understanding. So just in terms of some tools and takeaways, there are communication toolkits that are available and resources. And so there are actionable steps that you can take for using toolkits to build in strategic partnerships that promote equity and access. We'll make sure that that in the follow-up from today's session, that folks can also access some of these tools and community-based approaches that we actually use at Hopkins Center for Health Disparities Solutions. I think my email may go in the chat at some point, and there will be a way in which you can follow up with me so that I can share some of these resources that are appropriate to the health disparities and or the topics that you're focused on. And really, I want to leverage the understanding that partnerships for information equity is so important. So if you are a leader at your organization, making sure that you're not operating in a silo and that you're working with other local organizations, small business owners, is also important. Faith-based organizations, your schools. I always say this, that if you live, worship in a community, that is your community. That is where you belong. And so if you're spending 80 hours in the office, in a zip code that may be, dealing with a lot of health disparities and or challenges that you are combating within your nonprofit organization or within your academic institution, you are a member of that community. And so you owe it to yourself to make sure that, and owe it to the sort of the greater mission of doing good public health, ensure that folks are informed and that they have the right information, right? Just again, those are some tools, and we'll share those tools and key takeaways. I do want to just sort of ground us that, my work has been grounded in evidence, experience, and expertise. These pillars really help to guide how I approach community impact, but they also guide how I have approached my training and also policy in different places. So if you're looking on how to make impact within your community as it pertains to digital health, as it pertains to addressing the health disparities, comorbidities, and challenges that we've seen, I really want you to remember to make sure that evidence is in the conversation, right? So you should always back your work by current research and public health data. You want to make sure that your experience is rooted in lived community engagement and real world implementation. I come from the healthcare space, and when I worked for local healthcare in Baltimore, I remember a leader from Fayette Street Outreach organization, Tim Bridges, came in and he was like, "Hey, we know that you are an evaluator here and you are over our community health needs assessment. But we want to take you into our community so that you can do a walk and a talk and meet sort of the people behind the numbers, right? Because they have these numbers and this data, there are people that are connected to it." And, it was really a life-changing experience for me, right? That helped me to have real world understanding and implementation of the community that I was serving. And I was so excited about that. I know that there's a conversation, so I'll pause there before I go to expertise. Nerys, is there a question?
Yes, we have a quick question for you in the chat from Terry Mum. With the changes in the climate, how does that affect the perception of trusted sources, especially the federal agencies, CDC, etc.?
Yeah, so I talked a little bit about that, right? Our federal government still is a credible source. We are under a new administration, and whether you are in agreement with the current administration or not, I'm not here to dictate that. But what I am here to say is that public health has been around long before our current administration. And we have thousands of public health practitioners, some who are still with their federal agencies and some who have unfortunately been riffed or been impacted by the federal cuts, who took time and work and passion and resources to make sure that the data that we see, the resources that have been developed, the infographics, the video tutorials, that all of these information are grounded in science, again, grounded in research, and really grounded in also experiences that represent oftentimes communities in which they came from. And so I do want to encourage folks to still go to those federal agencies. CDC is a partner who I've worked with quite a bit on a number of projects, and I will tell you that the people who are boots on the ground, no pun intended, they are doing that's a little fan. They are really doing the work. And we don't want to discredit the work that they have been doing because of the challenges and the changes that we're seeing in the administration. So that's what I would share regarding that question. And then you know what, Terry, if that fails, or you're not confident in that, I want you to be confident in the expertise that we can build on, right? The foundation of academic institutions, of your clinicians, who you may have direct access to. So your primary care physicians and or our FQHCs, federally qualified health centers in our communities, and then even consultant excellence. So again, the 3 E's in terms of when you're looking at making impact in this space, make sure that there's the evidence, the experience, and the expertise are in alignment.
Thank you for that. That's a very thoughtful response, and it's come up. We're at Marylanders Online. We're creating some community health worker and public facing resources about how to identify trusted sources, and that question came up specifically. So that's very helpful. Thank you.
Thank you. And this conversation is a much broader conversation, and I think this is a perfect transition. This is, other sessions in which I've facilitated at Hopkins, at other institutions as well. I serve on an advisory board at my alma mater, Syracuse University, Folk College of Sport. And so, we are seeing how evaluation and misinformation across a spectrum of spaces can impact the work that we're doing. So feel free to most certainly reach out after today's session if you want to hear more about any of these topics or even other topics that's not listed here. In terms of just a reflection for today before we transition to Q&A, I want you to think about what role can I play or can you play in fighting misinformation and promoting equity in your sphere of influence. It's not sufficient for me to just come and sort of talk at you for the past 30 minutes, but I really want you to think about how you can reflect on what we've discussed. And I want to open the floor up and really invite you to reflect on, again, your role, the role that you can play in disrupting misinformation, starting today. And Reese, I know that you're monitoring the chat, and so if there's anyone who wants to write it in the chat or even unmute and share, the floor is yours.
Yep. Everyone, you can use the react button by raising your hand, or you can go ahead and just come off mute, or you can also type in the chat. We do have a note here from Angela Hopkins from Aztec Public Library. She mentioned that while AI offers valuable capabilities, one must always remember to research as well, as AI can misinform. So can you talk a little bit about how AI is misinforming us currently?
Yeah, so Angela, great question and great highlight. Regarding AI and misinformation, and this is just sort of data out is only as good as data in. So I have seen over the last decade, particularly in the AI space, the machine learning space, how the advances have been extremely credible and done a really, really good job at pulling together resources and research specific to your topic. Obviously, there sometimes tends to be bugs because, like I said, there's so much information now in the world of Google that, if you are using, for example, a chat GPT as a tool to access credible information, I would encourage you to always make sure that you use cues to include evidence-based items. I would also say not stop there, but try to access those articles, the research articles and or the data that's connected through it, whether it's data connected at your state level or even at the national level, again, through CDC and World Health Organization. I think last Friday's session, we touched a little bit on that. The speaker touched a bit on that. But with any tool or resource that you use, especially pertaining to AI, I would encourage the end user to make sure that you find the original source of that data and not sort of just rely on its natural response that may come, through the machine learning platform that you're using? Great question.
Thank you for that, Tati. The next one I have here in the chat, Terry asked if you can share the three E's.
Sure. So you want to make sure that evidence, expertise, evidence. I should know this by heart. You want to make sure that that is evidence based, right? So that the data that you're using is appropriate. You want to also make sure that you have the appropriate expertise or lived experience with you as well, or you want to leverage your lived experience rather. And then your experience, your expertise, and the evidence. Those are the three E's. So your evidence, so backed by the research, credible sources, public health data, preferably. Your experience, so rooted in lived community engagement, and real world implementation strategies, right? Which ties back again to the evidence. And then expertise, so building on foundations of academic, clinical, or even consultant expertise.
Next one we have here from Rolf. Could you comment on the potential mistrust that is unintentionally caused by discussions about structural bias and inequities?
Can you say that? Can you ask the question again, Nerys? I'm sorry.
Could you comment on the potential mistrust that is unintentionally caused by discussions about the structural bias and inequities?
So I'm not sure where the angle in which that conversation or that question is coming from. Can you said Rolf? Can you ask more or tell us more, Rolf?
And feel free to unmute, no problem. Is Rolf here? If not, we will come back to that.
Sure, because mistrust is. I'll just say this, and want to sort of hear a little bit more from Rolf and his lived experience. Mistrust is, it's real and it's present in a lot of communities, and that mistrust really stemmed from seasons of oppression and racism and discrimination and the structural biases and inequities, and that's why the mistrust is there. I always share, Rolf, with folks that it's not a problem that we have agendas, because I think that's where mistrust comes from, where there's a misalignment in terms of agendas, what you want or what I may want from coming to today's session, right? So it's not a problem that we have agendas. The challenge comes when we have hidden agendas. So I think that when working with community, or when institutions are working with community, and when community and lay persons are working with institutions, we have to be open and honest and transparent about what we want from that collaboration and from that experience. So I'm not sure if that answers your question, but I would love to follow up with you more and hear sort of more about your experience to give my thoughts. Is there another, Nerys?
Not currently. Again, if anyone has any questions, feel free to unmute or type them in the chat and I'll read it out. We do have a few comments though in the chat just about always checking sources that are referenced when you're using AI. Also encourage reflective and constructive conversations while highlighting credible resources and research within the community.
Yes, you definitely want to highlight credible resources and research. And I would also challenge our researchers that are on, in today's conversation, to make sure that you also give credit to the community when we have sort of the historical context, behind that research or that data as well.
Do we have, I'm not seeing any more questions in the chat. Do we have any final questions? I'll give it one minute or so for anyone to type or to unmute.
Mm-hmm. Yeah,
So,
always.
Naris, if I can ask. So my name is Isaias. I'm the director, Marylanders Online. Really thankful for your presentation today.
Thank you.
So, yeah, really appreciate the discussion. My question is very general. If you can share any lessons learned. We're a relatively new program within the university, so we're housed with a very credible university. So any lessons learned you can share with us, that'd be very helpful.
Yeah, thank you so much. And thank you for creating this space and with your staff. I think, again, partnerships are so important. So, lessons learned, I will say, myself as a scientist and as a researcher who came to Baltimore in 2015, 2016, and I was again in healthcare, working for another healthcare institution, not John Hopkins. And, one of my biggest lessons, and again, I grew up in Brooklyn, New York, primarily in the 80s and 90s. I have parents who migrated here, so I'm first generation immigrant parents. I have most certainly, benefited from a lot of different scholarships that have afforded me the opportunity to be in spaces and have access to spaces that I probably would not have as a Black and brown Afro-Latina. And I had to also recognize that, most of my training were in predominantly white institutions, Syracuse University, my bachelor's and my master's, and in the University of South Carolina, where I did my doctorate and studies. And I came to spaces with my own biases. And so there were things that I had to, what I would say, check about myself or correct about myself. There were things that I had to say, hey, it's time for you to sort of unlearn these things that you may have picked up in your training and not, again, judge folks. So that non-judgmental comment that was made earlier, that's one that sort of like really resonates with me. And I will, again, I think it's so important to have sort of real world conversations. And I'll just give an example quickly in our time. Prior to the pandemic, I was again working in healthcare for an institution in West Baltimore. And in an effort to really get to know the community better in which I was serving, I would go down to the local community-based organization. This community is in 21223 West Baltimore, and it's nestled between 3 neighborhood communities. And I would just go over to the community-based organization and sort of, meet the youth who were accessing it, meet the elderly, the adults, learn about their programs and their services. But it was also an opportunity for them to learn about who I was, Dr. Tati, the researcher. At the time, I was Dr. Warren to everyone in the community, right? But they got to see sort of the human side of me by just showing up and serving and leading with equity, or leading from an equitable lens, and leading also with a servitude heart. And because of that experience, when I had moved back home in 2019 to Panama, Central America, where my family is from, obviously the pandemic hit in 2020, and we started a virtual community that brought together, it was called Wine, Wings, and Wisdom. and we would meet once a month to talk about some of these issues that impacted health equity, and all of the changes. And I was that go to person for leveraging what started really in the community as an opportunity of sharing and making sure that we had credible resources, but not only sharing this information at the local level, but now sharing this information on a global level, because we were, all at home, virtual space, and had opportunity to now share what we were doing locally in Baltimore, and or me at the time I was in Panama, and then came back ultimately to the States, but share sort of what people lived experiences was, what their challenges were, why they were not in agreement with getting vaccinated or not, and make sure that, I think again the best lesson learned is that you come with sort of an open heart and an open mind, and lead from a space that requires intention with equity. So
Thank you for that, Dr. Tati. And we do have time for just one more question. I see Kelly has her hand up, so I'll let you go ahead.
hi, Kelly.
Hi, happy Freedom Friday.
I like that.
Thank you so much for the presentation. So many nuggets that I've taken away, particularly the idea that miscommunication isn't harmless, but it creates misinformation, which is harmful.
Yes.
Love that. Um, I am with Paradigm Insights, and we're a health equity firm here in Montgomery County. And essentially, we work at the intersection of health literacy, tech, strategic advocacy partnerships, and HIPAA privacy, patient rights.
Mm-hmm.
And to answer your question about my sphere of influence and how I combat misinformation, the thing that we target is centering community author knowledge, which means amplifying lived experience and cultural insights as legitimate data, in addition to the evidence-based research that you talked about.
Yes.
But then also designing AI and privacy literacy tools as well.
Thank you, Kelly.
Mm-hmm.
I love that. Please share your link in the chat if you have not done so. I think that you guys are doing amazing work at Paradigm Insights, you said, right?
Yes.
Yeah, I would love to connect with you in Montgomery County. This is exactly the type of partnerships that we need, both on our academy community, but also our lay community. And I love that you are empowering our local community in terms of their authorships and their stories, and how important that is, again, to support the data that we see. And folks often say, obviously I'm a researcher, and when I hear the term data driven, we're making data driven decisions, I often sort of cringe, and I like the term data informed decision making, because we know that data out is, again, only as good as data in. And if we're not, if we don't have the right sort of structures, if we don't have sort of a non-biased approach to how we manage data or collect data, or use data to tell a story, a narrative, then it can alter the story that we tell. So I love sort of that mixed methodology between our quantitative data, which of course has significant value, but that qualitative data really helps to enhance the story that we're telling. Thank you, Kelly.
Thank you for that, Kelly. I do see your hand up, Angela. However, we are out of time and I don't want to go over any longer. So I do want to say, Dr. Tati, if it's okay for you to put your email in the chat so that for any additional questions, you all can connect. Also, Dr. Tati's bio and contact information is on our website as well. So please feel free to reach out to Dr. Tati.
Yeah.
And it is 12:01, so I'm going to close out really quickly with a few closing remarks and information about our next two webinars. So thank you again, Dr. Tati, for being here. We really appreciate your insightful conversation and presentation as well. And I hope you all, people added some publications in the chat as well. So please feel free to click on those links and utilize that as well. So thank you so much for the insightful conversation that everyone's been having.
Thank you
And do you
so
mind if I
much.
share my screen really quick?
Yes, we will stop sharing. And again, I'm Dr. Tati Warren across all platforms. My email is there at drtati@justtati.com. Build with us, lead with us, and grow with us. Thank you, Nate. It has been a pleasure today.
Thank you so much again, Dr. Tati. And thank you everyone as well for your energy and engagement and commitment to advancing health access and technology. Before we close out, I do want to share a few quick reminders. On next week, we have our last two webinar sessions on social media impact on health misinformation, as well as digital health technologies and misinformation. So please, if you have not already, go ahead and register. You can find the link on our website, or you can scan the QR code. And then also, if you would like to get in touch with Marylanders Online, you can reach out to us via email or giving us a call at our tech helpline. We're open Mondays through Friday from 10 a.m. to 8 p.m. and Saturday from 10 a.m. to 5 p.m. And finally, you can also connect with Marylanders Online using our Facebook. We have a newsletter sign up as well, a LinkedIn and our Instagram. So you can scan our link tree to connect with us on social media. And thank you all for joining and attending our webinar session today. Please feel free to scan the QR code to do a post survey for Dr. Tati's session. And then you guys can also find that on our website and on your agenda as well. So we hope you leave here today feeling more informed and inspired. Take care, and we look forward to seeing you at our last two sessions. Thank you, everyone.
Tati, can you hear me before she just closes out? Wonderful presentation. Quick suggestion, take all of your infographic information, put it into an online ebook. That information is valuable.
Thank you so much. That's Dr. Jennifer. I know the voice. Thank you. Thank you, everyone, for joining.
Thank you, everyone.